So the Caregiver program here at UCSF was really stimulated by one of my patients' wives. Her name is Randy Murray. Her husband was Gordon Murray. She really helped us understand the gaps that we had and how to fill them.
When someone has a brain tumor, this sounds silly, but it's in their brain, so it can really change who they are as a person, their personality, and not everyone is like that, but Gordon, I would describe it as he became sort of a more extreme version of himself. And yet when we went for our appointments, Gordon was the kind of guy who just wanted to put on a good show for everybody. I'm doing great, I'm going to the gym, I feel great, I feel great, I feel great. And I saw all this other stuff behind the scenes, which was very hard. And I had a hard time getting anybody to listen to me because he was the patient. And there were some things I couldn't say in front of him. I have two wonderful close friends, Kathy Podell and Meredith Green. And the three of us started a fundraising effort.
Through philanthropic support and incredible generosity of donors, we have now the Gordon Murray Caregiver program.
Dr. Chang and Margaretta Page are the two people who really run the program day to day, and they are wonderful. So there's full-time staff, there's caregiver support groups. They've really coalesced all the resources available for caregivers. There's an annual caregivers workshop. There's a camp for families with children where a parent has a brain tumor. Margaretta now goes to the hospital when a patient has had surgery and meets the caregiver, gives them this great handbook that we've developed, and lets them know that there are these resources.
We were introduced to the caregiver program right from the get-go. Both nurses were great. Eric was diagnosed July 7th, 2018. He had 3 tumors in his head that were inoperable. He wanted to stop treatment. As a father, you want to fight. And one thing I really learned from the program, I had to take me being his father out of it. And the experiences, the people I've met there, the stories I heard, really helped me to be able to take care of my son in a better, more compassionate way.
So Doug was diagnosed with a brain tumor in October of 2010, so it's been 9 years. It's a tough diagnosis to hear. A lot of fear, a lot of questions. The only way to ever really get it is you gotta be going through it. You can intellectualize about it if you're not going through it, and you can probably make some pretty good guesses, but you can't really understand it till you're actually in it.
The purpose of the Caregiver program is very simple. It's empowering the caregivers so that they can feel that they are taking care the best possible way for their patient, and work with us so that we can help them take care of themselves. So we have a caregiver support group, for example, that's dedicated to the caregivers only, where they can be honest about how they're feeling, how hard it is.
Dr. Berger said things aren't going to really change along with my speech and my balance.
Right.
And and it's me just dealing with it.
We talk about that a lot in our group, about dealing with what's like now and how to, the new normal and how to proceed from there. Do you guys address that much in your group?
Yes.
Obviously, they get a lot of information and find out about a lot of resources. But I think just the experience of having someone else say to you, this is impossibly hard, but I'm telling you, you're going to get to the other side of it. You have to take care of yourself.
It's like for that hour, it's almost like a burden is lifted, because you can say anything and heads will nod and people understand. And then on top of that, you may get suggestions and ideas and techniques, but it's just a place to put down the burden for an hour. And that's huge.
They actually had us write a letter to ourselves. But we were writing it to a friend. Because as caregivers, we beat ourselves up. We truly do. You miss a med. You don't give it to them when you're supposed to give it to them. You just do something that you shouldn't have done. I remember the first time I yelled at my son. That's the person you're giving the care to is not It's your loved one, but it's not, it's the disease that's causing these issues. The memory loss, the eyesight, the mood swings. You know, it's all the disease. And that's the nice thing with the caregiver program. You learn that.
And ultimately, we're doing the good for the patient, because the more empowered a family member is, the better they are to care for their loved ones.
On October 17th, which is his birthday, we got on Facebook Live and went to a steakhouse, and everybody on Facebook Live got to enjoy his birthday dinner with us. People were asking us questions, so we were answering them. And then the next day we got up on the 18th and we went through Yellowstone. He videotaped us sitting there watching Old Faithful going off. He thought that was cool. And we just drove around, you know, having fun.
If there's anything you think you want to do, do it. Do it now. Take pictures, take a trip, take a video.
Regardless of what your thing is, you still have today. That's all any of us have is today.
And hopefully, wherever you're at, you have a caregiver program, because it's very important to have other people to talk to that's going through the same thing you're going through.